Hey, everyone, let's talk about something that can be a little embarrassing: bad breath. We've all been there, right? That awkward moment when you're talking to someone and you get a whiff of your own breath. It can really affect your confidence, but the good news is that bad breath is usually a pretty easy fix. Most of the time it comes down to simple things you can do to improve your oral hygiene and overall health. So in this video, I'm sharing my top 10 tips to help you say goodbye to bad breath for good. Okay, let's start with the most common culprit behind bad breath: poor oral hygiene. It's something many of us overlook, but it plays a crucial role in maintaining fresh breath and overall oral health. You see, our mouths are home to millions of bacteria, and while most of them are harmless, some can cause that unpleasant odor when they break down food particles in our mouths. These bacteria thrive in the warm, moist environment of our mouths, making it a perfect breeding ground. Think about it like this. When you don't brush and floss regularly, food particles get stuck between your teeth and along your gum line. These trapped particles are like a buffet for bacteria, providing them with the nutrients they need to multiply rapidly. This creates a feast for bacteria, and as they munch away, they release smelly sulfur compounds, the main reason for bad breath. These sulfur compounds are what give off that characteristic rotten egg smell. That's why maintaining good oral hygiene is crucial. Regular brushing and flossing help remove these food particles and reduce the number of bacteria in your mouth. It's not just about having a bright smile, it's about keeping those odor-causing bacteria in check. Using mouthwash can also help by killing bacteria and leaving your mouth feeling fresh. And remember, everyone's mouth is different. Some people may need to take extra steps to maintain their oral hygiene, depending on their unique oral environment. Some people naturally have more of these bacteria than others, which can make them more prone to bad breath. This can be due to genetics, diet, or even certain medical conditions. But even if you're prone to it, don't worry. There are plenty of ways to manage and reduce bad breath effectively. By following these tips, you can definitely get it under control. Regular dental checkups, proper brushing and flossing techniques, and a healthy diet all contribute to better oral health. So let's move on to the first line of defense: brushing and flossing. These simple daily habits can make a world of difference in keeping your breath fresh and your mouth healthy. You guys know I'm all about preventive care, and when it comes to bad breath, brushing and flossing are your best friends. These simple daily habits can make a world of difference in maintaining fresh breath and overall oral health. Think of your toothbrush as a scrub brush for your teeth. It's designed to sweep away food particles and surface stains. It removes food debris and plaque, that sticky film of bacteria that builds up on your teeth throughout the day. Plaque can lead to tooth decay and gum disease if not properly managed. But here's the thing, even the most thorough brushing can't reach those tight spaces between your teeth. These areas are often where food particles get trapped. That's where flossing comes in. Flossing is essential for removing debris and plaque from between your teeth and along the gum line. Flossing is like getting a deep clean for your teeth. It reaches places that your toothbrush simply can't, ensuring a more thorough clean. It dislodges food particles and plaque that your toothbrush can't reach, preventing them from turning into a bacterial buffet. This helps in preventing cavities and gum issues. And don't underestimate the power of fluoride toothpaste. Fluoride is a mineral that helps to rebuild weakened tooth enamel. Fluoride helps strengthen your tooth enamel and fight cavities, which can also contribute to bad breath. Remember, consistency is key. Regular use of fluoride toothpaste can significantly improve your oral health. Aim to brush your teeth for 2 minutes twice a day and floss at least once a day. This routine ensures that your mouth stays clean and healthy. Trust me, your breath will thank you for it. A consistent oral hygiene routine not only keeps your breath fresh, but also boosts your confidence. Now, let's talk about an often neglected area: your tongue. Believe it or not, your tongue can harbor a significant amount of bacteria, especially at the back. Those tiny bumps and grooves on your tongue's surface, they can trap food particles and bacteria, leading to, you guessed it, bad breath. That's why it's super important to make tongue cleaning a part of your daily oral hygiene routine. You can gently brush your tongue with your toothbrush or use a tongue scraper. Tongue scrapers are specifically designed to remove bacteria and debris from the surface of your tongue. Trust me, once you start cleaning your tongue regularly, you'll notice a big difference in the freshness of your breath. We've covered oral hygiene, but what about the food we eat? The choices we make at the dining table can have a significant impact on our breath. Our diet can play a huge role in how our breath smells. Certain foods can either help or hinder our quest for fresh breath. Let's be honest, we all love indulging in certain foods that are notorious for causing bad breath. It's hard to resist the temptation of these flavorful dishes. Garlic, onions, coffee, they might taste delicious, but they can linger on your breath for hours. These foods are known culprits for causing strong odors. These foods contain sulfur compounds that get absorbed into your bloodstream and released through your lungs when you breathe. This is why the smell can be so persistent. Now, I'm not saying you have to give up your favorite foods completely, but moderation is key. Enjoy them in smaller quantities and balance them with other foods. And when you do indulge, make sure to brush your teeth or chew some sugar-free gum afterward. This can help neutralize the odors and keep your breath fresh. On the flip side, there are also foods that can actually help freshen your breath. Incorporating these into your diet can be beneficial. Crunchy fruits and vegetables like apples, carrots, and celery act like natural toothbrushes, helping to clean your teeth and stimulate saliva production. This not only aids in digestion, but also keeps your breath smelling fresh. Staying hydrated is essential for overall health, but did you know it also plays a crucial role in fighting bad breath? When you're dehydrated, your mouth produces less saliva. Saliva is like your mouth's natural mouthwash. It helps wash away food particles and bacteria, neutralizing odors. Think about it. When your mouth is dry, it feels sticky and uncomfortable, right? That's a breeding ground for bacteria. So make sure you're drinking plenty of water throughout the day. Aim for 8 glasses a day or more if you're active or live in a hot climate. And here's a little tip. Keep a water bottle with you at all times so you can sip on it throughout the day. Let's talk about a quick and easy way to freshen your breath on the go sugar-free gum. Chewing sugar-free gum after meals can be surprisingly effective in combating bad breath. Here's why it works. Chewing gum stimulates saliva production, which helps wash away food particles and neutralize acids produced by bacteria in your mouth. But here's the catch. Make sure it's sugar-free. Chewing gum with sugar can actually worsen bad breath because the sugar feeds the bacteria in your mouth. Look for gum that contains xylitol. Xylitol is a natural sweetener that has been shown to reduce the growth of bacteria in the mouth. So, next time you're looking for a quick breath freshener, pop in a piece of sugar-free gum. I know going to the dentist isn't always the most exciting thing, but trust me, regular dental checkups are crucial for maintaining good oral health and fresh breath. Think of your dentist as your partner in fighting bad breath. They can identify and treat any underlying dental issues that may be contributing to your bad breath. During a checkup, your dentist will examine your teeth and gums for signs of gum disease, cavities, and other oral health problems. They can also give your teeth a professional cleaning, removing plaque and tartar buildup that you can't get rid of with regular brushing and flossing. Remember, prevention is always better than cure. Regular dental checkups can help catch problems early on, preventing them from turning into bigger issues that can affect your breath. Mouthwash can be a great addition to your oral hygiene routine, providing an extra boost of freshness and helping to kill bacteria that cause bad breath. But not all mouthwashes are created equal. Look for an antibacterial mouthwash that contains ingredients like chlorhexidine or cetylpyridinium chloride. These ingredients help kill the bacteria that cause bad breath. However, keep in mind that mouthwash should never be used as a substitute for brushing and flossing. It's meant to be an additional step in your oral care routine. And a word of caution, some mouthwashes contain alcohol, which can dry out your mouth. If you find that your mouth feels dry after using mouthwash, try switching to an alcohol-free version. Let's talk about a major culprit behind bad breath smoking. Smoking is incredibly harmful to your overall health, and your oral health is no exception. Smoking dries out your mouth, reduces saliva production, and creates a breeding ground for bacteria that cause bad breath. Plus, it stains your teeth, irritates your gums, and increases your risk of gum disease, all of which can contribute to bad breath. If you're a smoker, quitting is the single best thing you can do for your health, including your breath. Talk to your doctor about ways to quit. There are many resources available to help you kick the habit for good. While most cases of bad breath are related to oral hygiene and lifestyle factors, sometimes it can be a sign of an underlying health issue. If you've tried everything and your bad breath persists, it's important to see your doctor to rule out any medical conditions. Certain conditions like sinus infections, diabetes, acid reflux, GERD, and liver or kidney problems can cause bad breath. Your doctor can help determine the underlying cause of your bad breath and recommend the appropriate treatment. Remember, your oral health is connected to your overall health, so it's always best to err on the side of caution and seek professional advice if you have any concerns. So there you have it, my top 10 tips to help you say goodbye to bad breath. Remember, maintaining fresh breath is all about taking care of your oral health and overall well-being. By following these tips, you can feel confident in your interactions and never worry about bad breath holding you back. Thanks for watching. If you found these tips helpful, don't forget to like, comment, and subscribe for more health tips and advice. Stay fresh.